The second thing, the spasm gas. I will just go very quickly. What could be the cause of the spasm? Usually the first cause, if she is female and she came to you and have a spasm, the first thing you think about it's period pain, right? The period pain, and you will have the point that she will enter your pharmacy asking you, excuse me, do you have a blister? It's not the first thing. You will know that it's period pain. This is a kitab kida. Start. I need a Polistan, it's period pain. And by the way, Polistan, it's good. But why should you use a product if you can use a different product, and I can counsel you in the period pain and how your period pain could be, and this could be for the female much easy. Because if you are using only a Polistan, and by the way, there is a side effect of the Polistan that it prevented it stopped the blood, huh?
Yes, reduce the blood.
It reduced the blood. But after some time, later they feel that trapped and bloating. So which is not, they don't like it. So if I'm with you, if I'm in your place, I would just go for something for a strong, good painkiller like Mexigestic, and with Scopinan or Buscopan. Why Buscopan? It will work on the muscles. Okay. Other things I can advise here on primrose oil, or what we have in a pharmacy right now. Huh? Menoprim. One of the amazing products for all ladies, Menoprim. هو أنت المفروض لو if you use it right now, you'll not use it with the period. But if you use it before the period will come without the cramps, and it will be fixed. You will not have the irregularity at the period, although that the bleeding will be less. But we used before. Why we used to highlight the primrose oil? Because you know the primrose oil, it has a rule as an anti-inflammatory itself. It has a rule in adjusting the hormones. صح ولا لا؟ طيب اوكي.
دكتور وات الجدول في البريمروز oil؟
ها؟ لا go with the Menoprim. يعني if you will go with the item, go with the Menoprim. Menoprim because Menoprim it has primrose oil. It have primrose oil itself and have the cushion, and it has also the magnesium. So it's amazing product. It already has the magnesium. The magnesium will help in the muscle cramps, and it has the primrose oil, and it has also an anti-inflammatory and a lot of things in the Menoprim. Menoprim, it's an amazing product for all the women. And forget about it's written that it's for menopause. Well, it's for all, and all the people they can use it safely.
Okay, how can you use this?
Menoprim من شركة
How can you use those?
الدوز. هو الدوز بتاعته ايه؟ الدوز بتاعته ايه يعني؟ حبة مرتين في اليوم. الدوز بتاعته twice daily. هي العلبة the box 60 tablet serving 1 month. So once 1 tablet twice daily. Okay. Then the second thing will be the irritable bowel disease or irritable bowel syndrome. So the people will have constipation sometimes, diarrhea sometimes, they will have a bloating, they will have a lot of things. How we can treat this? The first thing to treat irritable bowel syndrome, the people with irritable bowel syndrome, it lasts with them for all the time. It's lifestyle treatment. You need to change your lifestyle. You need to change your food style so you will feel relaxed. You cannot just eat beans and eat other things and eat fibers with high quantity and then, or doesn't eat fibers at all and you will feel relaxed. No, you need to change your lifestyle. But immediately you can give something like Risperdal and something to relieve the gases. And for sure, in probiotic, in all the irritable bowel syndrome, everything related to GIT or vaginitis, you need to have the probiotic as an add-on. Why probiotic is amazing or an excellent choice add-on for GIT problem and vaginitis problem? Anybody knows?
Just of the normal flow.
It's like
it's not like vaccine, but it's normalizing something because you will have the trouble in your GIT or your vagina because there is disturbance of the normal flora existing. Once they have disturbance, already the bad bacteria will start to grow and then you will have the things. And by the way, and all the time, why we have gases? Why do people they complain about gases? If anybody came to you complaining about gases, so 100% they have a trouble in evacuation. Ask him how many times you are going to the washroom. You are eating 3 times or twice per day. So at least once per day you need to go to washroom. If you didn't do this, or this is not happening, this means it's already in your body. Then again it will be fermented and there is a microorganism. ما هو نوع الأكل affecting this لأن هو at the end so ما هو it's lifestyle treatment. But the point why there is a gases, I mean that why there is a gases لأنه في fermented food is still there and there is microorganisms feeding on that kind of residual foods and having a gases. So the first thing you need to take in consideration, having a probiotic will do again the balancing effect. And the good things about probiotic, once you have the balance, the movement again it will work. And then from that point you can advise him to use the fibers, the gummy fibers, again and again the things. But you need to understand and you need to teach your customer why gases could be a problem. Right? بس مش جيلك gases, okay, go with the disflatyl. Disflatyl will work now. And what about later on? What about after 1 or 2 days? Thank you. I'm still treating the symptom. It's not the cause. Right? طيب. Traveler diarrhea? No, this is one of the questions in the DHE exam. Drug of choice for traveler diarrhea? Ciprofloxacin. But please don't give ciprofloxacin to anybody unless you have a prescription. Okay? So just go with the normal thing. Go with the syrup and the syrup اللي هو عندنا ايش syrup? Captain syrup and with the flagyl or يعني حتى flagyl in Abu Dhabi it's not allowed, but flagyl in maybe in Dubai or Northern Emirates it will be allowed, and probiotic with the other disinfectant things. Omodium, I don't recommend to go with the Omodium unless the guy, مثلا هو he's traveling now and he has a work and he needs something to stop it now. But at the end you are stopping the motility. Okay, so everything will remain inside. All the toxins will remain inside. And I need just the toxin to go out. So I need to drink extra more and more waters to replenish the losing, and that's it. That's the point. But giving Omodium, I don't recommend that at all. Okay? The food poisoning, will give ORS because the food poisoning it will be accompanied with diarrhea with the vomiting. So when you have the vomiting, I need to add the ORS. You know what is ORS, right? Oral rehydration solutions. Okay? This is something which is salts and waters and things to replenish the hydration. And flagyl, again, ciprofloxacin, probiotic, and Buscopan for the muscle cramps, and probiotic, of course, instead of the antibiotic. مش في كل الأوقات، هو الفود بويزنينج ديجريز. يعني أنت لو أكلت كنتاكي مثلا وجالك فود بويزنينج مش هتطلع مستشفى. هيجيلك دايريا وفوميتنج بس it's not. If it is severe, of course, you will be in hospital. But if it is the normal things, يعني استافيلوكوكس ولا أشدوموناس ولا the things ولا الثاني اللي هي اسمها إيه عندنا اللي هي بتعمل فود بويزنينج اللي شريشة كولاي بتعمل فود بويزنينج. سالمونيلا في الميت تعمل الحاجات دي. Even you can have your immunity, but still it's not strong enough to stop it. But again, you need to have something to support you from outside. But if you reach to a position ان انت اكيد هتروح المستشفى. You need to go to hospital. بس دي ما بتحصل. The people who are reaching you in the pharmacy, they are mild case. You agree with that? طيب. The first one, the GERD syndrome. You know what is that? يا قطر انت قطر. عرفنا دي. مين اللي قال كلنا عارفين؟ طب قول يا عارف. طيب what are the symptoms of GERD syndrome؟ هو انت عارف؟ هو عارف. كلنا عارفين قال برضه. طيب what are the symptoms of GERD syndrome؟ يلا خلينا نقولها سوا. Heartburn, then ارتجاع أو irrigation. اوكي عندنا bloating, right? epigastric pain.
هو الهايبر اسيتي اللي هي
الهايبر اسيد الهارتبيرن. طب usually what is the drug of choice for the GERD syndrome? PPI. I need to go directly with the PPI because I need to give something will work immediately. I need to give something like Gaviscon to work immediately. Do you know what is the difference between Gaviscon and Malox? Gaviscon it works mechanically, okay, as a barrier, but Malox it works chemically. Because Malox it's two ingredients: magnesium what? Magnesium what? Magnesium hydroxide and aluminum hydroxide. مفيش aluminum carbonate. مفيش aluminum carbonate. Okay, and some the Reni it has calcium carbonate. Okay, the calcium carbonate, the same one which is available in the calcium product. But the calcium carbonate, the point in calcium carbonate, there is a rebound acidity with the calcium carbonate. But with the Malox, why they mix the magnesium with the aluminum? Because so they have it together. So again, they will reduce even inside counteracting the effect of each other, and we are using, but it gives just slight relief of the hyperacidity. But the drug of choice to relieve the GERD syndrome, you need to go with the proton pump inhibitor. Don't go with the old molecule of proton pump inhibitor. What is the old molecule of proton pump inhibitor? Omeprazole. Why you will not go with omeprazole? Omeprazole, it has many side effects. Many side effects. It's the old generation, so the old generation, it affects on the cytochrome P450, right? And even it could affect other medication absorptions and increase the liver enzymes, right? And the efficacy of the product it's not that high. So I will go with something which has a safety profile, a higher safety profile. Like I have a pantoprazole, I have simoprazole, I have bantazole, I have any product which in the push list. We have both products in the push list. So the main product will be something proton pump inhibitor, and I have Gaviscon or any other product, and probiotic. Please give a probiotic, and the people will love you. The people really will probiotic amazing product. I'm personally using probiotic.
دكتور الدومبي او النوتيا مهم في حاجه.
لو عنده ارتجاع. لو هو عنده لو مش كل الناس عندها ارتجاع. لو عنده ارتجاع، لو بيحصل عنده معدته مش مظبوطه يسجل نوتيا.
دكتور طلع ليه سكر هنا في المرات ولا مش؟ كان لازم سكر ليه انه بيطلع بريسكريبشن قبل كده في كذا دوله ثانيه.
لسه
عشان القلب كده
لسه ما نزلش. تمام. Okay, so probiotic. When I will give probiotic, it's simply that I'm giving you a product which will enrich the good bacteria in your body, and then again, it will enhance the performance of your GIT, enhance the performance of your system. So your system will work healthier than before, and that's what we all want. Okay, so let's summarize it. If I have GERD syndrome, I will have a bloating, I will have a hyperacidity, and sometimes I will have epigastric pain. So what will be the treatment? The treatment first, I need to have a treatment right now. I need to give something to relieve the heart pain right now, and then I will give the drug of choice, which will be proton pump inhibitor, and then I need to give something to support my treatment. right? Probiotic, and don't forget to tell your patient the lifestyle change. Don't eat before 2 hours from your bed. Do some sport, walk a little bit, and then don't smoke. Or even if you are smoking, just reduce the smoking and just elevate your head a little bit from the bed. So, this is something you build it with the customer. You are not selling him the item. You're just telling him again the advice, giving him the advice. Okay.